three eminent speakers joining with us today: Dr. Pramod Jog from Jog Children's Clinic, India; Dr. Louise Briva from John Hopkins Bloomberg School of Public Health, United States of America; then Dr. Charles Mbuh from Geneva Learning Foundation, Switzerland; and Professor Julian Savilsky from University of Oxford, United Kingdom. I warmly welcome you all to today's symposium. Moving on to the next talk, it will be by Dr. Charlotte Mbuh from Geneva Learning Foundation, Switzerland. The topic of the talk will be Immunization Agenda 2030, Geneva Learning Foundation. Dr. Charlotte is an immunization specialist with a background in community health and field epidemiology, who is currently working with the Geneva Learning Foundation, a Swiss-based organization, as global coordinator of peer networks. Before joining this organization to spearhead its health communication work in January 2020, she worked for several years as a disease surveillance officer for EPI coordinator at the subnational level in her own country, Cameroon. She's a part of a network of over 6,000 immunization professionals that have come together under the banner of Immunization Agenda 2030 to form the movement for IA 2030 with the goal of supporting one another through peer learning exercises to solve the challenges they face in their day-to-day work in immunization. Recently, she has championed the cause of women working in immunization through an initiative called Women Who Deliver Vaccines. Over to you, Dr. Charlotte.
Thank you very much, Madam Moderator, and it's a great pleasure and an honor for me to be part of this August event. And before I dive into really talking about Immunization Agenda 2030, which is a very a broad topic, I would like to tell you a little bit about the Geneva Learning Foundation and why we do the things we do. So we are an organization that exists to connect, to learn, and to lead change. So we try to catalyze large-scale peer networks of frontline actors facing critical threats to our society, such as they could be humanitarian, they could be health-related, they could be gender-related, and we have also done work around leadership and communication. So our approach is really rooted in research and experience in learning science, and we use intrinsic. I'm glad that a lot of the speakers that came before me, they talked about emotions, and we know that as far as immunization is concerned, communication, intrinsic motivation is very important to get the goals that we want to achieve. And so we develop and implement learning experiences that reach people in 137 countries. And like I said earlier, our programs cut across several domains, but over the past few years, we have had to focus a lot on immunization, especially with the impact of the COVID-19 pandemic on immunization outcomes. So you can find out more about us on your favorite social media platform, and feel free to leave any questions or comments. I will be delighted to respond. So within the context of immunization backsliding, we just recently got the VUNIC press release from UNICEF and WHO talking about the greatest backsliding that we have experienced in 2 decades. That is 25 million children that were not reached in 2021 with the most needed vaccine. And so I am sure the question that is burning on every mind is, what is the future of immunization? And I think that we can find some answers in Immunization Agenda 2030. So what is this strategy? It is global, and it is created for everyone, every country, whether it's the rich, the poor, and it's not owned by any one agency. And it's a living document that can be updated based on new priorities and challenges. For instance, with the COVID-19 pandemic, that was the case in point. the IA 2030 had to be updated and readjusted to meet the needs that were posed, especially the vaccine needs that were posed by the pandemic. We saw the COVAX facility that was put up, and the release of new vaccines at a very rapid scale. So the vision of IA 2030 is for a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And it's a framework that sits on 7 strategic priorities that are informed by four core principles. The strategic priorities are: we have immunization programs for primary health care, universal health coverage. We have commitment and demand coverage, equity, life course and integration, outbreaks and emergencies, supply and sustainability, research and innovation. And the framework is that immunization should be people-centered, country-owned, partnership-based, and data-guided. So why a call for action? At the 74th World Health Assembly, the Director General of the World Health Organization called for a broad social movement for immunization that will ensure that immunization remains high on global and regional health agendas and help to generate a groundswell of support or a social movement for immunization. That was at the adoption of Immunization Agenda 2030. So we at the Geneva Learning Foundation, we responded to this call because we had a community of over 40,000 immunization professionals from across the world. So we decided to focus on this in order to advance health work and country capacity and co-ownership of this global strategy. We wanted to support the rollout of COVID-19 vaccines and immunization, as well as primary healthcare services recovery. We wanted to try to see how to better equip and motivate and empower health practitioners to test, adapt, implement, scale up, and continuously improve interventions that better address their local challenges, increase effectiveness, and accelerate primary healthcare outcomes. Last but not the least, we also wanted to look at topics like vaccine hesitancy. We know that with the pandemic, we had an increase in the rate of vaccine hesitancy like never before because of infodemia and every other thing that you know around false information and rumors around immunization. We also wanted to focus on finding zero-dose children, scaling a promising practice, integrating COVID-19 vaccination of adults during routine immunization service, amongst others. So we therefore launched this call to join this movement. And on the 7th of March 2022, we have 6,319 immunization and public health, primary healthcare professionals from around the world who responded to the call, many of whom were in countries across Asia. Some countries have just one person, but that to us is very significant because one person is able to start a spark that can light up a fire and create a global movement that is making a difference. And so we used our approach, an approach that we call the full learning cycle, to get these professionals, immunization professionals, and members of the movement who signed up to be part of a series of peer learning exercises and field-based practice to help them solve their most urgent immunization challenge by answering a simple question. What is your most important immunization challenge, and what help do you need to solve it? So in response to that, we have a series of interventions over a course of 4 months, starting from what we call ideas generation, that is using a digital repository that we call the ideas engine, that in which all participants could inject and submit ideas and practices that they were implementing. Some of them could be innovative, some of them could just be implementing what exists on guidelines and adapting them to their local context, but they were there to share what they were trying to do and what was working for them to help others to meet their own needs and to solve their own challenges. So we went through from idea generation right up to situation analysis, action planning, and implementation. I'll be talking a little bit more about that in a moment. So what were the most common challenges that were faced by members of the movement? Most of them identified that their challenges had links with the first three strategic priorities. That is strategic priority one, that's focusing on immunization programs for primary health care and universal health coverage. Strategic priority 3 was next in line, that's on coverage and equity, and strategic priority 2, that's on commitment and demand. And you can see on the right side the key focus areas that most of these challenges belonged under. And so what have we been learning from these activities that we've been carrying out with members of the movement for Immunization Agenda 2030? The first thing is we launched the movement and we thought we were going to reach about 1,500 immunization professionals, but we ended up reaching over 6,000 who decided to sign up and be part of this movement. And so when we said we wanted to crowdsource and look for ideas and practices that were making a difference as far as immunization is concerned in their local context, 920 practices were shared in 10 days around all of the 7 strategic priorities. And over the course of 4 weeks, we asked members of the movement to do a root cause analysis of their priority challenge to understand the reasons, the real reasons why they were facing these challenges and see how they could be addressed. And we're able to members were able to develop 664 situation analysis that were peer reviewed over the course of 4 weeks. And afterwards we said, okay, now that you know the cause of your problem, are you ready to take take action? And so we had a 2-week action planning hackathon. We use the term hackathon because it is quick, it is fast, and it is based and it is focused on solutions. And so we were targeting 1,000 action plans. We got over 1,000 action plans that were developed by members of the movement. And afterwards, we asked them, now that you have developed an IA 2030 action plan, are you ready to do something about it? And so we started what we call the Impact Accelerator Launchpad, which is a kickstart of implementation with peer accountability over a course of 4 weeks with constant regular follow-up between 6 to 18 months. And we had 4,139 practitioners that signed up to participate in the Impact Accelerator. And currently, most of the 1,000 action plans that were developed are at different stages of implementation. But to us, it was not just about collating and gathering this and getting professionals to do things, but it was also about giving back to these practitioners through resources, through learning reports, through events that we co-created with IA 2030 working group members and global partners. And so we have been able to generate case studies and learning reports that we are sharing back with our movement members. And we also organize learning events that we called, for instance, we have what we call Teach to Reach. This is a global networking, meeting, learning together event through which practitioners from across the world, they get to meet on a one-on-one basis and in group basis to share experiences and learn from one another. And our focus is on the key topics that are really the challenges that people are facing as far as immunization is concerned: health worker motivation, raise zero dose communities, vaccine confidence, COVID-19 vaccination, gender. And we usually have over 3,000 people join these events. So we continued trying to explore and look for affordable and practical ways to extract meaning from all of that which we are doing. And here are just a number of graphics that try to give meaning to all of the things that are happening across our network. Here you'll see the social network analysis. It's communication across our network among health immunization professionals across countries, across system levels. So it's not just about the top-down approach of communication, but it's transversal. We also have communication, like I said, across system levels, and people get to share the impact of the COVID-19 pandemic on their routine immunization work. We are also having seeing an increase in a number of IA 2030 emerging leaders from so many countries across the world that are sharing their case studies and stories of how their work is being transformed through what they are learning in the network and as a part of the movement for Immunization Agenda 2030. We try to leverage on every available avenue and platform to ensure that the stories, the voices of local practitioners are being heard. So during the World Immunization Week, we asked members of the movement to share one thing that they do in their day-to-day activities to ensure that the goals for Immunization Agenda 2030 are met, and that the children, their populations, receive the vaccines that they need. And in a period of 1 week, we received over 1,000 pictures like these ones that you see on our screen of immunization professionals working on a daily basis, overcoming challenges to ensure that they get the vaccines to those that need them most. So what do we have next for the movement? Are we just going to end here? Not at all. So in the on the 14th of October, we are going to be having the 7th edition of our networking event, Teach to Reach Connect. Like I said, it's to meet, to network, and to learn with fellow immunization and other health professionals from all over the world. At Teach to Reach Connect 6 that took place on the 17th of June 2022, we had over 12,300 public health professionals from around the world that joined us. So what we try to do with Teach to Reach Connect is to build a bridge between local and global practitioners. We are trying to give voice to practitioners at the most local level. And instead of focusing on the top-down approach of knowledge and information transfer, we are trying to see a way to build a platform where the local and the global can meet together to exchange knowledge. And we have some members of our movement that had this to say: I can comfortably say I have gone global, although locally in the Gambia. That is Kurajuf. That's a Ministry of Health specialist in the Gambia. So some other person, I'm not a participant at Teach to Reach Connect, had this to say about the event. Said I had the privilege to interact with very highly qualified, internationally recognized health professionals. It's like an opportunity to dine with the creme de la creme of global health. So we have lots and lots of testimonials like this one, but I would like to leave you today with this comment that is like a call to action from Dr. Kate O'Brien, Director of Immunization at the World Health Organization, who said to us, the Insights unit of the Geneva Learning Foundation, she said we need people to feel like they have the authority and are empowered to lead change in their community, in their program at the most local level, understanding what the goal is and what the targets are, taking those critical things that really cannot be compromised and adapting all around that. So this is really a call to action, and I just wanted to end today with those words. And feel free, like I said earlier, to connect, to check us on social media to see what we are doing, all of the activities, and to listen most especially to the voices from the local level, because Immunization Agenda 2030 belongs to all of us. It's for everyone, everywhere, and it's not a duty for just one person. Thank you once again, Madam Moderator. And if there are any questions, I am on standby to respond to the best of my ability. Thank you.
One last question for Dr. Charlotte. What is the main challenge that you experienced in your country, Cameroon, when you implemented the immunization agenda in relation to the Immunization Accelerator 2030?
Okay, thank you for that question. Just for the sake of clarity, to say first and foremost that the work that we are doing cuts across many different countries, not just Cameroon. And the one common thing that cuts across many of the countries that we saw with the creation of the Movement for Immunization Agenda 2030, you know that with previous strategies, making guidelines available was always a kind of like a top-down approach. That is, it starts in Geneva, it could start in Washington, Seattle, where the guideline comes from the WHO and other global stakeholders, and the practitioners at the subnational and local levels. But what we tried to do and to do differently with IA 2030 was to make sure that the guideline, the strategy was available everywhere at the same time. First of all, from the point of developing the strategy to dissemination, it involved all the stakeholders, all the actors that are involved in immunization. And so the dissemination, we saw that we kind of like created a shortcut through this digital network to make sure that it's available. But in the community and in the network, people are still, you know, having challenges, having difficulties with accepting change, you know, accepting the new. So it takes time, it takes communication to get them to see that this is the new way of doing things. And I believe that the more events we organize, the more sessions we hold where we give voices to help to local health workers, we are seeing a kind of paradigm shift where there are more and more people that are being called upon to listen exactly to those people that are responsible for getting the vaccines to the arms of the children, to hear what are they doing, what are the challenges, and what do they expect from the global community and from global leaders and decision makers to help them do their work better.
Thank you very much. As we are pressed for time, I conclude this symposium. I congratulate all the speakers and I thank you all for making time to attend today and give these insightful talks on behalf of ASVAC.